Hello, preceptors. My name is Scott Broderick. I am the program manager here for the College of Central Florida's EMS programs. And today I want to do a quick video, and I mean quick, on how to do the charting for our students that are coming to you. Now, we have switched up to a new system, and I kind of want to show you what you are going to be expected to see and what the students will be asking you to do so that you don't get caught off guard from that. So with me saying that, let me shrink this down here and pull me out of the way. And I'm going to be talking about, so what the student's going to do is they're going to actually fill out some of this paperwork for you to sign, okay? And again, I got two up here. So today we're doing the emergency room videos. And so I'm going to click on this one because this is the one that, again, and it's going to have your location up there. This is the stuff that you will never ever see. The students will do this. However, if you see them doing things on their phone, they're probably putting in a little bit of patient information, which is sort of kind of okay as long as that's what they're doing. I don't have a problem with it. In times past, we kind of said, hey, don't have your phones out. But now they're going to be using this in order to do their documentation. And so, again, I think appropriate use of their phone is okay. Now, with that being said, though, they're going to ask you to fill out a couple things. And when I designed this, I designed it with one very specific thing in mind. Is very easy for you folks to use and understand. Okay, so there are two forms that they are going to have to do in order to get a signature from you. And the first one is the emergency room checkoff sheet. Now, again, they're going to fill this out for you. They're going to put in their name, and just so that you can see this, the ER they're going to put in whatever it is, and the date and time of the start of the clinical. And again, it should be in the 2-month date, 2-month time, 2025. And let's see here, we started at 9 o'clock because that's when we got there. Now, again, if they did something, that would be great. If they did not do it, again, please mark the 0 on that. But if it didn't apply to them, that's where the NA comes in. Now, of course, since we're all good and we want to locate everything, the triage area, hey, we want to know where all the different supplies are, how to put on some oxygen. Again, all of these things that a student would do as an EMT level in the ER. Now, I will tell you that we are planning on going live with the paramedics with this as well. But again, this is just for the EMTs as of right now, but it should apply for every one of them. We're not going to have the paramedics fill us out every time, maybe one time at the beginning, but after that. At this point, they're going to say, hey, the one thing that they are going to need is your name and your signature. And I can tell you that they're going to hand her the phone. And then, of course, this is my test preceptor, Mr. Hardy. And then our student signature, again, the student is going to sign this. And again, this is to say, hey, I actually did this. And if I'll move this up here, they're going to hit save, and that's all you got to do for that form. Again, the only thing that you're going to need to do as a preceptor for this is just to sign. And the second thing that they're going to ask you out is at the end of the day, they're going to ask you to fill out a clinical evaluation form. This is the same form that we used to use, our quote-unquote pink sheet that we used to have. This is the same form. Matter of fact, the only difference is it's electronic filing. So again, when you finish your clinical for the day, it can be done, slightly before the clinical. That's fine. And then again, the date and the time, the student should hand this to you, and it should all be done. Okay. Now, this is where you're going to put in where they were at. By the way, 1s are bad, 4s are really good. So if you're not sure about the scale is up here. Excellent, satisfactory. Folks, we are perfectly good with 3s and 4s. If you leave a 1 or a 2, though, I will probably get back in touch with you. So definitely want to do that. Again, here we go, because this student was just absolutely great. And then we got an area for preceptor comments, but man, student did awesome. We like good comments, by the way. If there was a problem, please feel free to mark it in there. Again, put your name and title in there. And then the student is going to sign it. Hopefully the student signs this before they even give it to you, okay? So they're going to sign it. But if you get there and let's say, there was something that I wanted to make sure that the preceptor knew about, you can click on this little flag here that clear for lead instructor follow-up. At that point, you've signed it, they've signed it, everybody knows what's going on. And by the way, please share your results with the student. We want them to know the feedback that you're giving them, okay? One of the comments I get a lot is, well, I don't give everybody 4s. Well, if they did an excellent job, give them a 4. If they did something that was not so good, give them a 2. If they were completely unsatisfactory, please feel free to give them a 1, okay? Because this is how we identify problems, and then more importantly, how we work to get them fixed. And we will provide them remedial training when we find out that they didn't do what they were supposed to do. That's all that you have to do. Everything else they're going to input. They have a form that they input for their patients, just so you know. Again, and I'm not going to go through the whole form, but they actually have a form that they're going to fill out on every one of their patient. And at that point, again, if I go back to their forms, and by the way, it's not going to let me save unless I, of course, fill out all the lovely fields here, because, you know, that's the way I did it. And again, blah, 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 blah. Okay. But again, I'm going to hit save on this patient, but then they now have another form to fill out. But this is something that you don't have to do. Folks, we do ask that they do patient assessments while they're in the emergency room. They can go in with you. They can go in with the doctors. But if we can, try to get them to do some hands-on evaluation. I think it's very important. The more sick people that they see, the faster they're going to be able to identify sick people in the real world. And that's what we're truly after. Okay, that's it for all this lovely stuff. And with that being said, let me pick this back up. Again, I want to thank all of you. I know that it's very tough. Sometimes it adds to your workload. I'm hoping that they take a little bit off of your workload when they do this. So I want to very much stress that. We want them to help you guys out as much as possible while they're in the emergency room, while they learn some valuable skills. Again, we thank you for all of your help. I can't stress that enough. And I truly do hope to get to see you when we're out in the clinical environment. Folks, thank you all for paying attention, and take care. Thank you.